Thanks for coming today. So as part of my role at the Centre for Social Impact, I've been involved in the evaluation of 50 lives since 2016. So traditionally we've produced a few big, quite chunky reports. A couple of months ago, we released a specific little snapshot on the Aboriginal experiences of Housing First, and then this one's on the youth experiences. So we really wanted just to drill down into a few more specific topics and what the results were looking like for a few subgroups that have been supported through the program. So a bit of background in the context of Youth Housing First. So internationally, there are specific Housing First for Youth models. We don't have one here in Perth yet, but one is being developed or is developed in development. So some of these results we found from this report are going to lead into that particular model. So one of the key differences for the Housing First for Youth model is that there's a focus on building young people's health and resilience in recognition of considerable trauma of youth homelessness. So these are the 5 principles from the international model there, and it's really around youth choice, wellness, and that individualised approach. So they're quite similar to the overall Housing First approach, but it really just highlights the additional need for the choice and trauma. So within the 50 Lives, 50 Homes project, overall there was about 400 people supported through the time it ran before the sector shifted towards the Advanced to Zero model. So of those, 110 were young people that were supported through the program. About a quarter were Aboriginal, 9% were identified as trans or gender diverse. So overall of everyone that was gender diverse in the 50 Lives program, 80% were in this youth group. So something that may not be seen overall for homelessness, but again, needs to be considered in the context of Housing First for youth. Of the people that completed the self-report VI SPEDAT, on average, people spent 3.5 years experiencing homelessness. So this was less than the adults' experience, which was about 5 years from memory, which, I mean, is good in a way that you want a shorter experience of homelessness, especially the earlier the intervention to get people out of that situation. But still, given that these are people under 25 and the average amount of time they were still spending homelessness was 3.5 years. And that's not necessarily just before they got into the program, that was at the time they did the survey, which could have been a couple of years before they got into the program. So it's pretty confronting statistics there. So some of the other self-report conditions, 85 or 84% had at least one serious health condition. 94% reported problematic drug and alcohol use, and 78% had a serious health condition, AOD use, and a mental health condition. These are people under 25. And that's similar to what we're seeing in the adult population overall. So you can just see the impact that it has on people at such a young age. In terms of more diagnosis-related statistics. So for a subgroup, so for 76 of these individuals, we're able to get GP records. And these are the kind of mental health conditions that were coming through. So 41% had depression, 24% had diagnosed PTSD, and we know that generally that's really underdiagnosed. So that's probably an underrepresentative of what the overall impact was. There's a few other statistics up there. So really high in terms of what's seen in the general population, where depression affects about 15% of anyone at any given time. In terms of drug use, the highest one was amphetamine use, which was about 1/3 of people that were using substances. I don't know if you can read this quote up here, but when I was doing one of the interviews with one of the young people, it was quite confronting to hear. They'd been working with days for a really long time and they had aged out of the service. So they aged out at 21, I think they were 22 now. and they were really scared about what happens if they had a relapse now, because they weren't ready to access adult services. But they felt like if something happened, they wouldn't really know where to go. So that was kind of one of the key gaps, I suppose, identified within this project here, that there's that middle ground for young people between that 21, 22 and say 26, where they've got to transition to adult services. And it can be quite confronting going from people your own age to people that have had 3 decades or so of homelessness. So for a subset of people that had hospital use, just in terms of, I suppose, cost-saving measures for what Housing First can do. So in the 3 years before accessing 50 Lives, for these 80 young people, there was nearly 700 ED presentations, which is about $600,000 worth of hospital use. And a total of 265 days admitted. Now, 1,800 days admitted, 260 presentations. An inpatient admission is about $3,000 a night. So that's nearly $5 million over that time of hospital use for these 80 individuals. And the impact that housing can play in terms of diverting people around that crisis access of health services is really significant. So for the young people, overall, 43% were housed at some point. So obviously over time, there was a lot of housing successes early on in the program, but as we got towards the end, there was a lot more pressure on the rental market, and options and waiting lists become much longer. So only about 43% were housed, which was similar to the overall percentage of people in the program. At the end of the first year, 71% sustained their tenancies. So this was actually less than adults. And what we found was between the 6-month mark, where about 90% of people were still in their properties, it really dropped from that 6 to 12-month period, indicating that, again, there might be some additional support needed to help keep people in their properties and work through other issues or whatever that might be going on. So just for the individuals that were housed, so this is the hospital use for them. So this is from the day they were housed, from the year before that to the year after that they were still in the house. There was a 24% reduction in presentations, 26% reduction in inpatient admissions, and that was also a reduction in the amount of days. So when people were presenting to hospital, they were presenting for shorter periods of time. So I did quite a few interviews with young people throughout the program, and some of the key things that came through for them in terms of what helped keep them in their tenancies and what made them feel safe and secure was really around accessing services that were enabling them to develop independent living skills. So for many of them, it was the first time living on their own and having to manage a tenancy. So budgeting and cooking and cleaning and all of those kind of practical life skills there. It was really important to be able to have caseworkers and after hours service and things like that that came in and provided that support for them, but also that kind of practical support, such as access to some brokerage money and getting white goods and helping actually furnish their homes and actually making it feel like their home was also really important. And I love the quote in green on there, that this particular young person was just speaking really candidly about how they don't need after hours anymore, how they relied on them quite a bit in the start, but actually they've taught them all the skills that they need. And it's still nice to have that safety net there if anything went wrong, that they can call up and be like, I need help tonight or whatever. But they're actually managing their tenancy really well now. I'll probably just skip through the case study just for terms of times, but some of the challenges that came through around sustaining tenancies was the actual appropriateness of housing. So there was a lot of property abandonments for young people. So this was much higher in the young group compared to the overall adults. And a lot of this came through in the interviews as fears of safety of neighbours. So they may have been put in inappropriate units or neighbourhoods where there was neighbours coming around and banging on their doors at all hours of the night or during the day or whatever it was, because they're a young person on their own and they didn't have those kind of measures in place to feel safe and confident, and put some boundaries in with the neighbours. There was also a really big problem with social isolation. For many, they had come from, couch surfing with friends or in camps with friends, and to now have a property on their own, and that guilt and shame around still having friends rough sleeping was something that really came through in the interviews as well. So what does that mean for a housing first model for young people? So actual recognition of the trauma experience during this time and embedding those trauma-informed type responses into the model, and acknowledging that trauma and the ongoing impact of trauma needs to be addressed in order to prioritise wellness, safety and recovery in support. Earlier intervention and prevention. Obviously, the earlier we intervene for some of these individuals, the better outcomes people will have. Preventing homelessness is always the best option for people, and to actually prevent that experience of trauma from happening in the first time. Responding to mental health. So actually finding services that provide that dual diagnosis care, which was more of an issue in the adult services than in the youth services I found, but still just that recognition of the impact of drug and alcohol use and mental health, and actually treating those concurrently rather than bouncing between different systems and making more barriers for people to have to try and navigate. Actually linking people to education and training and meaningful activities. It was quite amazing to see how many people I interviewed who'd been housed for a while now, that they'd been working on their mental health and working on other goals, and now they had set some goals for, I'm going to TAFE next year, or I want, this is what I want to train up in and work in. A few of them were working towards getting their licenses and cars, and I think it's really important that as the support workers and as a sector that you're giving people the opportunities to set those goals themselves and helping them to progress towards those achievements for them. And finally, housing choice. I know Leah has said this to me many times throughout the evaluation over the last 5 years, but for young people, a lot of people don't necessarily want the forever home. So when we're thinking of housing allocations for people, thinking about placing people in forever homes can be quite scary and quite daunting. People do like to move around and be able to go through that experience of sharing with friends and trying different living circumstances. So I think making sure that while we're housing people, it's their decision about what type and what structure of housing they're getting, and that there's a bit of flexibility in there so that there's we can move in and out as sees fit. So that was kind of the main things that came out for the particular youth report for me. So I believe there'll be questions later on in the day. So we'll pass on to the next.
Well, thanks for that, Shannon. Does anyone have any